So one of the most common questions I hear from chiropractors is regarding their new patient special. Should I offer a new patient special? I don't want to discount my services too much. And what should that special offer be? And really, this is a conversation around trying to lower the barrier of entry for people who have never experienced chiropractic care before. In fact, only 30 to 35 million Americans see a chiropractor every year. So the vast majority of the population has never experienced what it's like to work with a chiropractor and all the things that a chiropractor can help with. When a patient is dealing with a health concern or some type of pain point or whatever the case is, they're not sure if a chiropractor is the right place to go. They're out there actively seeking help. And when they see your ad or your website or whatever, they're not exactly sure if this is the best place to get support. So for them, going to see a chiropractor is a risk. They're not sure if the investment and the time that they put into this is going to be the right solution. So when you talk about your new patient special, if you were to charge $100, $200, or whatever the case is for that first visit, that's a risk for them. That's a gamble that they have to take. The higher the price point, the bigger the risk it is for the patient to come in and see if chiropractic care is the right solution for them. When you start lowering the price, you're decreasing the barrier for people to come in and see if chiropractic care is right for them. It's much easier for an individual patient to risk $20, $30, $50 to see if this is a good fit and going to help them with their health concern versus something like $80, $100, $150. That becomes a much bigger risk. The flip side of this is that you don't want to lower your price point to a place where now you're pulling in way too many tire kickers. There's always going to be a percentage of leads that are low quality and they're not ready to convert. They're not going to sign up for a long-term care plan. So this is a lever that you have to kind of pull and play with a little bit. The lower the price point, the more volume of leads and new patients you'll probably experience coming in the door, but then it decreases the quality of that lead. More people are willing to take that risk. More people are going to be a one visit and you'll never see them again. As you increase your price point and you put the lever in the other direction, you are increasing the barrier to entry, which means you'll have less volume of leads coming in the door and less new patients of people walking in. But the benefit is that typically those leads are going to be higher quality. Since they're risking more, they're much more likely to probably sign up for care. So for your practice, you kind of have to find a good balance. What is a good price point? Do I increase my offer because I want better quality leads and less volume? Or do I want to decrease the price point so I can get more volume and then just kind of filter through some of the lower quality patients that are coming through? Every practice is going to operate a little bit differently depending on where you're at in practice and how aggressive you're trying to get with your new patient volume. But don't be scared to try and test different price points to see if you can find a good balance that works well for your practice.